Hi everyone, and welcome to the latest in our series of video question and answer sessions. Today I'm joined by Professor David Pencheon. David is an honorary professor here at the University of Exeter and has been a world leader of efforts to tackle the climate emergency from within healthcare. He was responsible for setting up the Sustainable Development Unit for NHS England and Public Health England in 2007, and he was in charge of that until his retirement in 2018. His current role at Exeter is to understand the part health professionals and health systems play in ensuring a safe, equitable and prosperous planet for all. David was awarded the OBE in 2012 for services to public health and to the NHS, and has just won the British Medical Journal Outstanding Contribution to Health Award for his work. So welcome, David. Thanks very much for joining me.
Thank you. No worries.
If I could start with a kind of question looking back a little bit, how did you become involved at looking at the environmental impact of healthcare?
Well, I've always been, in a sense, an environmentalist ever since I was a young child. I mean, I've always been fascinated. I can't remember a time when I wasn't. But I suppose the interesting thing was I went to medical school and qualified as a doctor. And I sort of put that environmental side of my life to one side, thinking I was now involved in another worthy project
Right.
about healthcare and health, which of course are two completely different things. But actually over the past 20 years, in the sort of last third of my career, I just became so frustrated that, you know, the organized efforts of society were not addressing what was clearly one of the world's greatest challenges. Not the only great challenge, but one of the world's greatest challenges. And I suddenly realized I'd been compartmentalizing my life. So I thought, well, you only live once. But I couldn't think of how to sort of manifest my values and my beliefs and my passion in the limited spare time. So I thought I should bring the two parts of my life together. And absolutely fortuitously, the Climate Change Act in 2008 came along, and the NHS, to sort of do their bit, set up this unit. So it was all a sort of rather fortuitous confluence of events. And it's good. It was good. It was very timely for me, and I hope very timely for everyone else.
Well, yeah, I mean, I was going to say, at the moment, everyone is, we've had climate protests, you know, pre-COVID, and it's something that's big on the agenda. But even in 2007, it wasn't really so much for a lot of people. So, I mean, what made you recognise the need to focus on it, and how did you persuade people to fund it and get on board?
Well, I didn't do the hard graft about persuading people to fund it. That was done by others. I suppose I recognized in the rest of the world what I slowly recognized in myself, that we can compartmentalize issues that are existential, I guess, are so scary that we all rationalize it and cope with it by saying, well, it's someone else's problem, or it's in the future, or I'm doing my bit. And I suppose I was becoming savvy enough to realize that wasn't going to cut it. It's not what we feel that matters, it's what we do that matters.
Yeah.
And I thought that, and I was particularly intrigued by my fellow doctors and nurses and healthcare managers who mostly would say, you know, I'm too busy saving patients to save the planet. And I thought, of course we're all run off our feet, we're very, very busy. But actually, I started to think that was a cop-out. And then when you look at just the sheer size of the NHS as an organization, regardless of what it does, I mean, it's about 10% of the GDP.
Wow.
So it employs about 10% of the total country's workforce, directly or indirectly. So it is a massive, massive enterprise in its own right, regardless of what its objective is. And also, I thought, because it's a reasonably well-respected institution with reasonably well-respected people within it, our behavior as organizations and as individuals are part of the normalizing process of what is normal and what is abnormal. And I just thought, I can't take this anymore. I've got to do something about this. However, whatever it meant, I needed to do something about it. So those were the sort of rationales. So I had a sort of Damascus experience quite late in life, really, that I think the system was as guilty, and I was as guilty as the system, and vice versa.
And in healthcare, I mean, thinking about the wider industry, what is the biggest contributor to emissions?
Well, it's big. Everything is big. I mean, it's a bit like, I mean, I always think it's a bit like saying Tesco's is the biggest wine supplier. I mean, it's the biggest wine supplier because it's big. You know, it's a big shop. And the NHS, it doesn't matter what you look at in the NHS, it's big. So, for instance, it's the biggest buyer of food in the country.
Wow, okay.
So, but actually, we sort of thought initially that the biggest contributions would be things like energy.
Yeah.
We burn a lot of energy. In fact, we do burn a hell of a lot of energy. But actually, the biggest contribution is really what we buy.
Okay.
So even though about 70 to 80% of the money we spend is on wages in the NHS, what we buy, like medical technology, pharmaceuticals, that has a staggeringly big footprint. I don't think we've completely bottomed out why that is, but I mean, pharmaceuticals is only one example, but it is a big example. But about 3/4 of the footprint of the NHS is what we buy. The rest is how we travel and how we use energy. But the overwhelming amount is from what we buy. And that's true for us as individuals as well.
Yeah. So what can the system do? Not, you know, I guess not just the NHS, but everyone who works in the system, what can be done to improve the carbon footprint?
Well, the obvious thing is to make everything more efficient. You know, insulate hospitals, cut down on waste, that sort of thing. Things that we're all trying to do in our everyday life. But actually, even if we did all that, even if we made hospitals uber efficient, even if we cut down waste to zero, it would not cut it. It would not have the desired effect.
Right.
And I think what we learned and we're still learning in a sense, Emma, is that you have to really go back to your original business model of what is the NHS there for? Just like you have to go back and, you know, other colleagues in the university would say, what is the economy for?
Yeah.
And you have to, and the NHS is there essentially, it's evolved over decades as a sort of rescue service. It's not really a health service, it's an illness service. And I know that sounds odd, but it is an illness service. And we pick up the pieces where we fail to maintain and preserve and protect health. And actually, the biggest thing we could do is to make the NHS smaller. I know everybody thinks the NHS should be bigger. It's a great thing. We should have more hospitals, more doctors, more nurses. But actually, it would make a lot more sense if we were smaller. Okay. So if we're heading to net zero, then we want to make sure that every ton of carbon we spend in the health service is carbon well spent, is carbon well emitted, in that it couldn't have been done anywhere else. I mean, the NHS is essentially a failure system. We pick up pieces where we fail to protect and promote health and prevent illness in the earliest stages of illness. So if I walked you around a hospital now, almost every patient would have an element of preventability in their condition.
Right.
Okay. So we often invest money in the health care system when we should invest it in the wider health system, like education, green spaces, good jobs, you know, equitable opportunities for all, that sort of thing. It's a very unpopular thing to say in the health service that we need to spend less on the health service. But yes. that's the irony. So you need to go back and visit the business model of the health service. So in summary, we need to not just make it more efficient, we need to transform it as to what it's doing. Smaller hospitals, smarter hospitals, hospitals closer to home, care closer to home, more prevention, as well as all the efficiency issues we talked about.
Yeah, I mean, I've heard you talk before about the connection between human health and you know, the planetary health, the health of the climate. Do you think that people just don't pay enough attention to the climate because they don't associate it with their own personal health? And if we could change that narrative, that would make a difference.
I think that's right. I mean, I think changing narrative is a lot of, you know, and again, I mean, as I said, I'm as guilty of compartmentalizing issues as anybody else is. But when I hear people say, you know, I realized that climate was an environmental issue, I didn't realize it was a health issue, that sort of is a window into our souls about the degree, you know, to me, I thought, how can you think like that? But that's just my narrow-mindedness, in that I assume that everybody thinks a bit like me, and of course we don't. We all think differently. So you're right. I mean, people, in a sense, one of the things I often say to my colleagues, and I encourage them to say to each other, is that stop talking about climate as an environmental issue, because we as doctors and nurses are not environmentalists. Start talking about it as a health issue, and that's your issue, Emma, about changing the narrative. We're supposed to be health experts. Climate chaos, climate breakdown is a health issue. We should be concerned for the health of our patients, the health of our populations. We have a duty of care in that respect. So you're right, it is about framing it to make it relevant.
Yeah.
Because quite often for people who are busy, like doctors and nurses, we think, well, I'd like to be concerned, but I've got a sick patient right in front of me.
Yeah. And do you think that there's anything we, as users of the health system, can do to influence change or to help? Because obviously we don't make the decisions.
Well, I think there are lots of things we can do. I mean, one of the sort of unfortunate paradoxical downsides of the success of the NHS, that it's free at the point of contact, it's a national institution, is that we sort of take it for granted. That we think, well, it doesn't really matter if I don't look after my health as much as I know I should do, because I know the NHS will be there to pick up the pieces. So in a sense, the best thing we can do as citizens is to make sure we only use the NHS when we really need to. That we use and we understand what it is that creates health.
Right.
And I think we don't have the health creating environment, the health creating society that we would all benefit from. Not just the needy or the elderly or children, or we would all benefit from a more healthy society, a more health creating society. And the NHS is just small and smart and there to do things for our health which no other intervention, no other determinant would do. That would make a big difference. Yeah.
Okay. And just finally, the NHS does have a net zero target, I think by 2050, like a lot of other organisations. Do you think that's achievable?
Well, I think it's got to be achievable, because I think all the evidence suggests if we don't get to net zero well before 2050, we're toast, really. So I think it's really, but we've got to do it, and I think we've got to talk as though we're going to do it as well. I think we shouldn't debate about whether it's possible. We should just say we're going to do this because we have to do this. We have a duty to ourselves and to future generations to do this. So I think you've got to tell future truths. If you don't tell future truths, you don't create the environment in which it's seen by enough people to be possible. Yeah.
Brilliant. I mean, we hear the same thing about the climate emergency, where people say it's an emergency, but they don't necessarily act like
it's an emergency. That's one thing that health professionals should be good at. We love emergencies. We're crisis junkies. Unfortunately, climate chaos is slightly a slow burn emergency. We always feel like we can put off our actions till tomorrow. And on a sort of grand scale, on a geological scale, it's an explosion.
Yeah.
It really is an emergency. But we are so time bound, and we're not a future focused species. That's not how we've evolved.
No. Well, thank you so much for your time, David. It's been really interesting to talk to you and hear more about that. And I hope everyone's enjoyed listening to us.
Thank you.